Coronavirus now causing a mysterious and deadly illness in children. In fact, 1/3 of all the deaths nationwide so far have come in Colorado. It is called multi-system inflammatory syndrome in children, or MIS-C. CBS 4's Jamie Leary talked with a doctor who's seen the cases. Jamie, we learned today 2 children in Colorado have died, sadly.
And those deaths were not here at Rocky Mountain Hospital for children, but we do know that the doctor here says they know a lot about the symptoms, and he says it's important that parents know too.
Children, when they get COVID, usually don't have the advanced respiratory problems we see in adults, but they do have other symptoms.
Dr. Reginald Washington has seen many of those symptoms. Some result in Kawasaki, a syndrome that's been around for decades. But MIS-C, it's new.
We had not described this as a medical profession before COVID.
Unlike Kawasaki, it's a direct result of COVID-19. The critical part, inflammation of the blood vessels.
The blood vessels, including the lungs, but elsewhere as well, the heart, the kidneys, the GI tract, the intestines, all of those have been described.
It's a hyper-response to the virus doctors don't fully understand.
The first thing your viewers need to understand is that there's no test to see if your child has MIS-C. Because it's a syndrome.
Meaning there are multiple symptoms, including a prolonged fever, headache, rash, redness of the palms and soles of the feet, stomach pain, and diarrhea.
So if they have enough of those things and they have evidence that they've had the COVID virus, that's how the diagnosis is made.
In most cases, there are no underlying conditions.
We don't want parents to panic, but we do want them to be on the lookout for these symptoms.
Dr. Washington says that 3 children treated here for MIS-C have since been released. They have no COVID-positive children here as well, fortunately. 7 total cases of MIS-C here in Colorado. Reporting live in Denver, Jamie Leary covering Colorado First.